After undergoing cancer surgery, waiting for the pathology report can feel like an eternity, and when the results come back, you might encounter terms that are unfamiliar. One such term is positive margins, which means that cancer cells were found at the very edge or outer surface of the tissue that was removed during your operation. This finding is significant because the surgeon's goal is always to remove all cancerous tissue along with a surrounding border of healthy, cancer-free tissue, often called clear margins or negative margins. When margins are positive, it suggests that some cancer cells might still be present in your body, remaining at the site of the original tumor after the surgery. This increases the risk that the cancer could return in the future. Discovering positive margins does not mean the surgery was unsuccessful, but it does mean that your medical team will likely recommend further steps to ensure the best possible outcome. This could involve another surgical procedure to remove more tissue, or it might mean considering additional treatments like radiation therapy or chemotherapy to target any remaining cells. Your doctors will carefully evaluate your specific situation to determine the most appropriate path forward. Understanding these results is crucial. The tissue removed during surgery is meticulously examined by a specialized doctor called a pathologist. They slice the tissue thinly and look at it under a microscope to identify cancer cells. Negative margins mean no cancer cells are seen at the edges of the removed tissue, indicating a good chance that all the cancer was taken out. Positive margins, on the other hand, indicate the presence of those cells at the edge, signaling potential residual disease. Knowing what positive margins mean empowers you to have a more informed discussion with your healthcare team about the next steps in your treatment journey, helping you understand why certain additional therapies might be recommended to proactively reduce the risk of the cancer returning.